Ever wondered what's the most common gastrointestinal disorder seen in outpatient clinics? It's none other than gastroesophageal reflux disease, more commonly known as GERD. GERD is essentially a condition where acid stomach contents reflux or flow back into the esophagus. This reflux often produces the symptoms of heartburn, and not just once in a blue moon. We're talking about experiencing this discomfort on at least 2 occasions per week. If this reflux continues unabated, it leads to inflammation of the esophageal mucous membrane. Yes, that's right, the lining of the esophagus becomes inflamed. But here's where it gets even more concerning. If the condition persists and isn't addressed, the lining of the esophagus undergoes a change. It changes from squamous epithelium to columnar epithelium. Now, why should this concern you? Well, this change increases the risk for the development of adenocarcinoma at the lower end of the esophagus. Adenocarcinoma is a type of cancer that forms in mucus-secreting glands, and it's not something to take lightly. So, what causes GERD? The culprits can vary, but some of the common causes include failure of the lower esophageal sphincter, hiatus hernia of the diaphragm, and abdominal obesity. The lower esophageal sphincter, or LES, is a bundle of muscles at the low end of the esophagus, where it meets the stomach. When the LES doesn't close all the way, or if it opens too often, acid produced by your stomach can move up into your esophagus, leading to GERD. A hiatus hernia, on the other hand, happens when part of your stomach pushes upward through your diaphragm. The diaphragm normally keeps your stomach acid from rising into your esophagus, but a hiatus hernia can make it easier for the acid to move up. Lastly, abdominal obesity. Simply put, the more overweight you are, the more pressure there is on your stomach, and that can force your stomach content up into the esophagus, causing GERD. To summarize, GERD is a common gastrointestinal disorder characterized by frequent heartburn due to the reflux of stomach acid into the esophagus. If left untreated, it can lead to inflammation of the esophageal lining and even increase the risk of adenocarcinoma. Common causes include failure of the lower esophageal sphincter, hiatus hernia, and abdominal obesity. It's essential to recognize the symptoms and risks of GERD and seek treatment to prevent further complications.